10 of our geriatric mental health echo, as is the last of this cycle. There'll be 2 more cycles coming up that we can tell you about later. And today is actually fans' favorite, because this was Flex session was based on, as you may recall, a poll. So supporting caregivers' mental health came out on top. So I'm excited to introduce Cindy Brcko, who's a registered social worker at Baycrest, where I work in Toronto. And Cindy's been at Baycrest for over 20 years, and she's had a lot of different clinical experiences across that time, really ranging from day programs to counseling and really a whole range of services at Baycrest. She's involved in clinical care, obviously, but also in teaching and doing some research. And she teaches actively at the University of Toronto. So we're delighted to have you with us today, Cindy. And I'll hand it over to you. Take it away.
Great. Well, thank you so much. This is a very timely topic, and I'm glad to hear it was a favorite and it was a top choice. So I will begin. So supporting caregivers' mental health. So that's me, and I just want to confirm that there are no relationships with financial interests. And this program has not received any financial support other than the support of the Public Health Agency of Canada. This program has not received any in-kind support, and I do not have any conflict of interest to disclose. The information presented in this CME program is based on recent information that is explicitly or try best to be evidence-based. Its material is peer-reviewed, and all the recommendations involving clinical medicine are based on evidence that is accepted within the profession, and all scientific research referred to, reported, or used in the CME CPD activity is supported, or justification of patient care recommendations conforms to the generally accepted standards. So today we have about 20 to 25 minutes to talk a little bit about, caregivers are so very diverse, but I just chose a few to look at. Most expected kind of, and maybe a couple a little unexpected. Review mental health risks and consequences of caregiving, and discuss what we can do to better support the increasing needs of caregivers. So very timely. So May is National Caregiver Month, and this Caregiver Aware campaign is a campaign to celebrate the caregivers across Canada, around Canada, who play a very critical role in providing physical care, emotional care, and mental support to family members, friends, neighbors. And the purpose is to raise awareness about the experience of caregivers. And this particular campaign is a collaborative effort among caregiver organizations across the country. And last week was Canadian Mental Health Week, so from May 1st to 7th. So it's really great to have this opportunity to align these 2 awareness campaigns. So first we have a poll question, and I think that's so it's there it is. So the first question is, how many Canadians identify as a caregiver? And I'll take up the answers. Okay. And then I guess we jump right into the second poll question. So you are correct with the first one. So the first poll is, well, 58% of you guessed correctly, and it is 1 in 4 caregivers are identify as caregivers, and actually it's anticipated that 1 in 2 will provide care at some point in their lifetime. The second poll question is, how much do caregivers contribute to the Canadian care economy annually? If you want to enter in your answer.
Sorry, Cindy, I think they already did. So
oh, they did already. Okay,
yeah,
sorry.
Yeah.
Okay, so let me just see what your. Okay, so the correct answer is 97.1 billion dollars are contributed by caregivers to the Canadian care economy. And, you know, also just noting that lost economic productivity due to caregiving responsibilities is estimated to be 1.3 billion annually. So it's kind of this push-pull where they're contributing so much because of their efforts, but they're also not able to work in their jobs and contribute to the economy because of their caregiving responsibilities. Okay. So just move on. Okay, story. Just trying to move to my next slide.
Sometimes you have to use the arrows down in the bottom left.
Yeah, I am doing that. Okay, let's try this again. Sorry, everyone. It is not moving.
Or would you be able to, you have the slides, would you be able to show them instead?
Yeah, I can share the slides if that works better.
Thank you. Thank you.
So
sorry,
Cindy,
it is just frozen.
Yeah, you'd have to do stop share.
Okay.
Then I think Farah could take over. Yeah.
Okay, here we go. There we go. Sorry about that, everyone. It's the beauty of technology.
No worries, we'll get them up in a second.
Okay.
Sorry, I'm just trying to look through my. Do you see the slides now?
Yep, that's great. Thanks.
Okay, all right.
I'm going to go down past the polls.
Yes.
Yep.
Just let me know when to go to the next slide, then I'll just go to.
Okay, great. Yes. So thank you so much, Farah. So, so we can now jump into, we've seen some staggering statistics, and want to jump into the diversity of caregivers. And of course, we talk a lot about women as caregivers. So if you could just move to the next slide, please. So I'm sure we've seen this a lot lately on social media, and we hear a lot about Emma Hemming Willis. And if you haven't, this is the spouse of actor Bruce Willis, who is infamous for his leading role in multiple action films, including Die Hard. And she's been speaking out publicly about her husband's FTD diagnosis and her experience as a caregiver. So in the social media post, which I think has gone viral, she expresses candidly about grief and loss and sadness. She also, part of why that arrow is there is that it was a video talk she was expressing. She made comments about, people say to me, you're so strong. I don't know how you do it. I don't have a choice. I wish I did. And I just wanted to bring that up and to show a face of a caregiver, a very famous face, or her husband is famous. But there was a study, which is interesting, a recent study that examined perceived choice. And I just, before we get into that poll, just wanted to talk about that, this study quickly. Choice, meaning, and control related to caregiving among family caregivers. And it was found that a higher proportion of participants who were female in this study, married or in a common law relationship and living with the care recipient, tended to have less choice about caregiving needs. And those family caregivers with choice in caregiving reported a significantly higher levels of satisfaction and fewer psychological symptoms as compared to those who perceived that they did not have choice. So participants reported a higher life satisfaction when caregiving for children, parents, relatives, and non-kin relatives, but not necessarily for spouses. We're going to be talking about some of the mental health risks and consequences, the feelings, the emotions, and the mental health piece, but I just wanted to highlight that too, in terms of, this post and, what we hear from female caregivers, particularly looking after their spouses. So most caregivers have a positive outlook on their experience and a sense of fulfillment, but 2/3 admit they actually have no choice but to assume the work of caregiving. So this is the next poll question. So just in relation to women as caregivers, how many Canadian women provided some form of care to children and care dependent adults? Okay. So that was a little bit of a trick because, in the past two, the last answer was the correct one, but it's actually 8.4 million, which is still very, very high. So 8.4 million, 52% of women 15 and older provide some form of care to children and care-dependent adults. So, but that is a lot of women. So we can move on to the next slide. Yeah, so there's, I'm just going to close this here. Just some additional statistics. So 23% of unpaid care to an adult with long-term conditions or disabilities. 7% are more likely to be provide dual care, sandwich caregivers. Emma Hemming Willis is doing that. She's a 44-year-old woman with caring for a spouse with FTD and 2 children under the age of 10. Women are more likely than men to engage in caregiving activities that need to be completed on a regular basis or a set schedule. And women are more likely to provide emotional support. So it's really important to highlight this group of caregivers. I can move on to the next. So older caregivers. So for those of us who, well, all of us who work in geriatrics, we do see this population a lot as well. So that it includes both men and women, of course, but almost 1/4 of people 65 and over provide care or help to family members, friends, or friends with a long-term condition, a physical or mental disability, or problems related to aging. And 1/3 of caregivers 65 and up provides care for a spouse or partner. What's interesting is that with age, the proportion increases. So as people get older, the care for their spouse or partner increases. Among seniors aged 75 to 84, men and women are equally likely to have caregiving responsibilities. And then I find this interesting as well. The gap reverses among Canadians aged 85. So this is, I guess, the oldest of the old, I guess, is sometimes they're called, where 17% of men were caregivers compared to 11% of women. And the reasoning around that is women's life expectancy is longer than men. And so they are more likely at that age to be widowed, as opposed to, and the men are more likely to be living with a surviving spouse and caring for them. So this is another interesting group that we don't talk about. It's almost the reverse. So we had a visit or a presentation from a faculty member from the Factor in Inwantosh Faculty of Social Work at the University of Toronto. And she was talking about her research on grandparents as caregivers. And it's something we don't talk about, but in practice, I do hear about it, and I'm sure many of you have heard about it too. So an estimated 51,000 older adults are the primary caregivers for their grandchildren. And it's often referred to as skip generation families. And so adding to the burden of caring for these grandchildren, many of these older adults are also involved in the care of their adult children, many of whom who have physical, mental, or substance abuse issues, and then also their spouses. And this is referred to as compound caregiving. And then obviously this group becomes very at risk because they then are aging themselves and then inevitably often, will develop some sort of physical or mental long-term condition. Yeah, we can move on. So the other group that we're hearing more about and with caregivers are the young caregivers. And again, in practice, seeing this a lot. It can be grandchildren or younger family members or friends related to the older adults. So 1.9 million young Canadians between the ages of 15 and 29 help family members or friends with long-term health conditions, disabilities, or aging needs. It's estimated that this is much higher, and it's a very largely invisible group. But most, 4 out of 10 of these young caregivers, they're mostly helping a grandparent, and this can be attributed to multi-generational homes. So this is just a bit of a snapshot of some of the caregivers that we're seeing. And of course, it's very complex, and there's a combination of many different factors. But what are the mental health risks and consequences? I mean, we often focus on, the negative aspects, and we research the negative aspects of caregiving. And the reason we do this is because we need to identify those most at risk in order to advocate for policy change, financial compensation, the development of new programs and services to support caregivers. But we need to look at some of those, what we're seeing in practice, again, is some of the risks and consequences. If we can move to the next, Farah, please. So we know that caregiving is a demanding and complex and stressful job. Caregivers provide medical treatment, personal care, assistance, often without any training. They're expected to navigate this complicated health and social systems, and they must act often as substitute decision makers. It's a very, very big burden and stress. So this is a really great visualization here. We also, a lot of caregivers are workers, and the more than half of caregivers in Canada report feeling tired and feeling worried or anxious. And these are precursors to more long-term chronic conditions such as anxiety or depression or insomnia, but this is what is reported. So it's more often women, the proportion's higher women that report these things as opposed to men, but caregivers are very stressed and overwhelmed. You can move on to the next. So those caring for someone with dementia are more likely to report distress than those who are not. Caregivers who attempt to balance caregiving with other activities that have a difficult time focusing on aspects of caregiving that are positive, and they, feel more of the, or experience more of the negative reactions, such as the increased sense of burden or stress. And in terms of satisfaction, these employed caregivers, and there are so many of them, 1 in 7 employed caregivers are dissatisfied with their work-life balance. And some of the at-risk predictors for employed caregivers include the more hours of care that they provide. They're more at risk for having a poor work-life balance. Caring for somebody with cancer or mental health and addictions take a higher toll on care providers, more so than just age-related issues, but it excludes cognitive conditions. Caring for a spouse or a partner also has is identified as a risk factor, and also somebody when the care recipient is living in supportive housing is a risk factor as well. Caregiver burden and depressive symptoms are the most common negative outcomes of providing care for the elderly and chronically ill, and evidence shows that caregiver burden is a precursor to depressive symptoms. Care recipient behaviors such as screaming, yelling, swearing, threatening are associated with increased caregiver clinical depression. And studies revealed that depression occurs in at least 1 in 3 caregivers with dementia. Here in Toronto, in North York, part of Toronto, I'm a part of the North York Elder Abuse Network. And one of the topics that comes up a lot is caregiver stress and its relationship, or the increased risk of elder abuse and neglect. So in this particular study, it was found that the rates are quite high, 25% among caregivers who are stressed, and that where there are some at-risk behaviors in the home. This could include yelling, screaming, it could be physical abuse, it could be financial abuse, sexual abuse, but the risk is there. The care recipients the care recipient's level of care is a predictive of this harmful behavior. And then caregivers themselves who are in poor health are also at higher risk of harmful behaviors. So moving along to what can we do to support the caregivers? So if you're not in a position to provide these directly, I think it's really important that we educate ourselves as clinicians in terms of what kinds of supports and services are out there for caregivers, and we need to be able to refer our clients, our patients to such services in order to support them, because caregivers are obviously, as we saw from those initial statistics and what we know in working with them, they are a very, very precious and valuable resource in our country. So we need to know what's out there to support them. So we sometimes refer to caregivers as the secondary patient. So in this view, we see that caregivers also require the attention and the care, and we need to protect their health and safety because the demands of caregiving put them at increased risk for injury and adverse events. And we also need to recognize that caregivers are unpaid care providers who need support to acquire skills and learn how to be confident and competent in their role. So with psychoeducational interventions, across Canada, there are so many, but in particularly with Ontario, and then even more in Toronto based, I can speak to those ones. Psychoeducational interventions are really can be very helpful in terms of providing information around disease process, symptom management, information around the physical aspects of caregiving, enhancing communication between caregivers and the care recipient, among family members, and with healthcare professionals, learning strategies around self-care, coping, managing stress, problem solving and decision making, and in the psychoeducational, the peer support in those groups can be really incredible. And connecting people to valuable and very important community resources and services. Mindfulness-based interventions are very popular and can be very, very therapeutic and helpful for people in terms of meditation and mindfulness-based cognitive therapy, looking at concentrating on the present experience non-judgmentally, and recognizing and accepting the unpleasant cognitions, emotions, and sensations that are a part of life. And a big part of these interventions is stress reduction. Physical activity, recommending that people are physically active. The physical benefits are there, of course, reducing cardiovascular disease, reducing stress, reducing the risk of depression, improving mental and cognitive health, improving general well-being, and sleep and self-care and respite. Counseling, which I can definitely speak to, in psychotherapy, cognitive behavioral therapy. Counseling can take place with individuals, couples, families. It can be support groups. There's a lot of resources out there addressing stress, depression, loss, grief, loneliness, changing relationships, social isolation, and learning strategies to help cope with coping and problem solving and enhancing communication. We also have technology-based interventions, which we all know was incredibly invaluable during the pandemic, as people were not able to access support and services, and being able to connect with people online and accessing information online, incredibly important. Here at Baycrest, we have the Koshitsky Center for Innovations in Caregiving, which has incredible resources. The Alzheimer's Society, of course, is a wonderful resource for caregivers and anyone who wants to access information and support. And the Ontario Caregiving Organization is really incredible. And Woodgreen is something that's hot off the press. I just heard about today. It's a Toronto-based organization, community organization, and they're now offering free caregiving video guides. And they help people navigate the healthcare system, which we all know is incredibly complex, even for us sometimes. And giving people the tools, the skills training is incredibly important, so that people know they can provide the best care, the informed care to their care recipients, and so that they have the skills and abilities to do it and feel confident. And confidence might be effective in reducing or minimizing anxiety. There's an excellent study that looked at a training program. It was a communication-based program that trains family caregivers and partners to effectively communicate with persons with Alzheimer's disease. It's called TRACED, and it stands for Training and Communication Enhancement for Dementia. And just to describe it briefly, skills-based training, it compensates for cognitive and communication limitations and of the person with Alzheimer's dementia, and at the same time connects the person on a relational level by affirming, supporting, and enhancing the person's self-expression, but also recognizing the family's pre-existing communication patterns. Yes, I can definitely share the resources. I can send that in after. Yes. So many different excellent programs and examples for supporting our caregivers. And we need to do this, as mentioned, as I wrap up. It's incredibly important. Our caregivers are a very precious resource, national resource, and we need them as aging, our population ages, as those with dementia. We have more seniors with dementia and other care needs. We definitely need to support our caregivers and their mental health and their well-being. So just last slide to thank you. And thank you for supporting caregivers' mental health.
Thanks so much, Cindy. And Farah, I think we could stop sharing the slides now. Great. Thanks, everyone. And if you're able to turn on your camera, that would be really great. Love seeing you all. So yes, thanks so much, Cindy. And it's a huge topic, really. We have probably about 10 minutes for questions. And there's a question from Shresha Laxman. Important question, actually, about the flip side, I guess, of caregiving, which is that some people may get life satisfaction, a sense of belongingness by having opportunities to care for their family members or others. So while recognizing the challenge and the burden of the work involved, could you make any comments about that, the more positive aspects?
Absolutely, absolutely. And you know, that's what I kind of commented at one point, is that I was sharing kind of, the negative aspects of it, but definitely there can be so much meaning in a caregiving relationship, and really give a lot of caregivers purpose. And it's really important to celebrate that. And I think that with the supports that people can do that and really focus on, you know, the importance of that relationship, it's really important, I think, rather than being in the throes of, you know, the care activities, which are, you know, very important. They're necessities. Otherwise, you know, we can't neglect those things. So it's absolutely important to give caregivers respite, you know, allow them, give them the tools to care, provide care successfully and with confidence and competence as well. But yeah, we cannot lose sight of the most wonderful things that come out of caregiving, for sure, in terms of building relationships, not only between the care provider and the care recipient, but among family members and among communities. It can be a very rewarding experience.
Yeah, thanks, Cindy. Lauren Gardner has an important question too. Lauren, are you able to unmute? And can you, you're a social worker as well, I think, right?
I'm a nurse practitioner, actually.
Nurse practitioner, okay.
Yeah. I always find folks, you know, all of the really great interventions you offered, it's so challenging to support people to make or find time when they already have so much on their plate, and particularly the folks that you cited that are caring for a parent or spouse and children and all of the various people, and to try to anything you can offer that you found success in supporting people to make or find that time. I just find that's so often the barrier that they bring up.
Yeah, well, I have to say that, you know, one of the, if we can say, benefits of the pandemic, I don't know if we can say that, but, you know, was just the increased use of online programs and accessing that. At Baycrest, I work in an outpatient geriatric clinic, and we closed our in-person services, of course, as many of us did, and we provided all of our service and care and support online, and that was invaluable. And it was, you know, for somebody who's caring for somebody too, to be able to go into the next room and receive support, or to be able to, for the the clinicians to see the home and to see the interaction between the two to provide the support to the care recipient and the care provider. I think the online piece is really important, helps with time, with travel, especially if we're working with an older population and there's transportation issues and so on and so forth. So I think that is a piece, but really reinforcing with people, we see as, it's the whole imagery around the oxygen mask, and we hear about that, and we talk about caregivers needing the oxygen and taking care of themselves. We really need to encourage people to take care of themselves, because often it's, I think we see in our practices, sometimes it's not too late, but people are already really suffering by the time that they are out there trying to access help. And it's very overwhelming. It's not easy. I think it's the encouragement and developing, good, positive professional relationships with the caregivers and encouraging them to access support for themselves. But it's hard. It's a big juggle.
Thank you. There's a question from Amanda Robinson. Are you able to unmute and ask your question?
Yeah, sorry. I was just wondering, we have a lot of clients who have had like long-standing caregivers, like the caregivers have devoted years of their life to caregiving, especially a spouse or a child. And then once that loved one has passed away, their sense of identity and whole purpose is no longer there. So I'm wondering if you have any resources or suggestions on how to support the caregiver after their loved one has passed away.
Absolutely. I experienced that with clients myself, and there was actually a very good study, and I can share the resource. And it was around working with people, and prior to this is people with, in this particular study, with advanced Alzheimer's dementia, and working with them, providing support and counseling during that time, and then being able to provide up until, at the point of bereavement after they've passed. And I think, again, it's the development of relationships and really knowing, when people, encouraging people to reach out for support and bereavement support, knowing beforehand, what to expect, I think is really important. I think sometimes people, when we talk about death and dying, people are so overwhelmed with what's going on in the present that they don't even want to go there and know. But, the more that they can do beforehand, and if we can encourage them to do that, look out at in your local communities for support services, counseling, whether it's one-on-one, if it's group, or family counseling. I think that could be really beneficial to support that journey from illness through death, and then after they're gone.
And Charlene has put a very useful resource called Care Blazers. I love that term, Care Blazers, in the chat. So it's a YouTube videos, apparently. Thank you, Charlene.
That's great.
That sounds amazing. And Nicole McAllister, do you want to unmute? You have a suggestion there?
Yeah, sure. Hi, everybody. Something that was taught to me a while ago was when we're talking about, often people know what they need to do that'll help them, but it's a matter of orchestrating it and how do you get that put into place. So a question that we were taught to ask is, what do you need in order for you to do X, Y, and Z that we've talked about? What do you need in place so that you can do these things? And that's where we can have some, influence and help the person strategize with what is it that they need so that they can tend to these things. Because it's often not a desire, or they know they need to do it, but it's they can't because of. And so looking at that piece and seeing if we can support that piece has been helpful. Yeah.
Absolutely. That's a great strategy, a great way of looking at it. That reminds me a lot of cognitive behavioral therapy as well, where you are looking at, some of the barriers, that kind of keep you from kind of moving forward with plans. But I like that perspective that you have, and kind of addressing some of those things that are keeping you from moving forward, and how can you kind of look at it in a different way, reframe it. I like that suggestion.
And Tara makes the important point that it's important to validate that what caregivers feel is normal, not to feel ashamed or guilty for wanting to a break, because we see that a lot, right? With certain caregivers, that they just feel a deep sense of obligation, and that they don't even, that it's not normal to want to take a break, which is, so validating that is clearly vital in supporting them. And then Taylor in Winnipeg has a comment too. Are you able to unmute and let us know about that? Possibly not.
Oh,
yes.
Can you hear me? Yeah.
Yes.
Okay, cool.
Taylor.
Yeah, I was just commenting, and to be honest, I just got back from mat leave, so I haven't actually connected with this resource recently, but in the past, this agency, I guess for lack of a better term, Caregiving with Confidence here in Winnipeg, so maybe there's similar agencies elsewhere, who runs caregiving support groups. They're super welcoming to having folks like you described who maybe a lot of their purpose in life or their identity was wrapped up in caregiving can still attend. And the ones who do, they did at one point mention that it was a really positive thing for the current caregivers who could take from that person's experience, and also for that former caregiver, for lack of a better word, to be able to use that purpose still, even though that person had passed, that role, that identity was still being used. So I just thought I'd mention that. Maybe it's available elsewhere with different agencies. I think these ones, they're not, they're just local, but worth looking into.
Thanks, Taylor. And I see a hand up from Carla. Maybe we'll take this question or comment, and then we'll move on to the case presentations today. Go ahead, Carla.
Hi, can you hear me?
Yep.
Yeah, I was just curious to hear from the group. I work in home care as a PT, and I often see a large percentage of people with Parkinson's disease, and struggle with sitting in people's kitchens and in their living rooms and feeling that they really, with more advanced disease, like they've lived with, disease for 10 years, 15 years, and really many just they really have no idea where they are on the continuum perhaps with this. And we can never predict, when someone might die. We can't. But I feel that they frequently share with me, if I just knew how long I was going to be here, I would hire now, but, I can't, 10 years from now, I'm not going to have the money to do this. And I'm thinking, you're not going to be here in 10 years. Like, I just feel, I'm just curious, like, if there are organizations, facilities, teams where there's more active screening and like you say, giving people information. Knowledge is power, having people be informed about where they are in the disease process, so that there was a couple last year and they were in very advanced disease, and she's like, we can't afford to hire private help. Like, I was thinking, maybe some social work would be really helpful, some counseling for the two of them, and a little bit of PSW to help them get through the day. And they were open to it. But it was like just really, and I'm thinking, I don't really think it's my place to start saying, well, I really think according to your, how you're presenting that you might not be here in 5 years or even 2 years. But yeah, I just feel often with, it's not a cancer diagnosis, where sometimes people, I think, maybe are given a little bit more information as things are progressing in terms of where they are. And of course, we can't predict, but I mean, there are stages to that disease. And yeah, that's just kind of my thing I struggle with in my practice around caregiving and seeing people that are really, really burnt out often. Yeah.
Yeah. Do you want to comment on that, Cindy?
Yeah, Parkinson's disease, as those of us who work with people with Parkinson's disease, I mean, everybody's different, right? And the trajectory is so different for every person. And we brought up a number of different factors, you know, finances and the ability to afford extra help. You know, is it the financial piece, you know, which it is very most often, or a lot of the times, or is there some sort of resistance or reluctance to kind of move forward with care because they don't perceive themselves as needing care, or because they're not ready for it, and they think that they're going to, you know, get better. It's hard to say. The Parkinson's Society, and I would say any, you know, related kind of support group, one of the others, I'm sorry, I can't remember who it was, had mentioned the support group, you know, talking about experiences, you know, of others. And, you know, sometimes it's good to hear that. I mean, some people get scared in support groups too, hearing what another person's trajectory is. But I think it's, you know, being where the person is at. I think that we all, as, you know, if you're providing care in the home, or you're seeing people in the home, Carla, it's really, it's difficult. You see them in their home situation. This is where they want to be. And it's, you just want to provide them support where they're at. And I think as a physio, for sure, you would, you know, really be promoting the idea of safety. And, you know, I think that coupled with, you know, the psychological or the social support, psychological support, you know, of a social worker or a therapist, you know, might be really helpful too. So it's you know, multi-dimensional. It sounds like there's, you know, the social support, psychological support, you know, the skills training, all of that together. But yeah, it's hard to, we can't convince people, you know, to do different things if they don't feel that they're ready.
Yeah, thanks, Cindy. And I think it was Shelley in the chat notes that, you know, a palliative approach to care, which now is not end of life, it's chronic illness. A palliative approach to chronic illness, I think, can be very, very helpful, because it demands kind of an upfront discussion with the patient and family about what's actually going on and where things are likely to go in the future, and, you know, focus on what's really, really critical. I agree with you. I think we're often reluctant to sort of give people a roadmap, a journey, and a map of the journey ahead. And I think we should do that. I think we could do that better, actually. Well, thanks, everyone. Particularly thank you, Cindy. And I think we'll move on